Welcome to today's training session. This is the third series release to provide you with an updated knowledge on the revisions made recently in the State Operational Manual under F841 on role of Medical Director. This training will provide a comprehensive overview of the updates to the F841 Medical Director role, including expanded responsibilities, key focus areas, and the implications for compliance and resident care. These significant changes, announced by the Centers for Medicare and Medicaid Services as part of their recent release in November 18, 2024, was aimed to enhance oversight, streamline compliance, and improve the quality of care in nursing homes. Let's dive into what these updates mean for you and your long-term care facility. Before we begin our training, please listen carefully to our disclaimer. This training is for informational purposes only and reflects updated CMS guidance as of the session date. While efforts were made to ensure accuracy, it does not constitute legal, medical, or professional advice. Participants should consult official CMS documents, guidelines, or their compliance teams for specific questions. The trainers and hosting organization are not liable for actions based on this training, and compliance remains the responsibility of each facility. Refer to official source document in the link below. For official guidance, refer to CMS resources or source documents. Today's training focuses on the updated F841 Medical Director role and its implications for facility operations from the latest release of the State Operational Manual. We'll begin by introducing the key updates and expanded responsibilities, emphasizing the medical director's role in implementing resident care policies and ensuring adherence to professional standards. Next, we'll dive into specific updates, including the oversight of practitioner performance and addressing inappropriate medical care. We'll then review investigative protocols and examples of deficiencies to highlight the importance of compliance. Finally, we'll discuss practical strategies for applying these updates and outline the next steps for successful implementation in your facility. In this section, we will explore the expanded responsibilities of the medical director and their impact on resident care and facility operations. The updated role emphasizes three key focus areas. First, medical directors are now tasked with ensuring the effective implementation of resident care policies, which includes overseeing practitioner adherence to professional standards and addressing inconsistencies in medical care. Second, there is an expectation for active involvement in facility assessments, specifically referencing F838. This includes contributing to the evaluation of facility needs and ensuring policies reflect the unique environment and resident population. Finally, the medical director must enhance their role in coordinating medical care through quality assurance committees. This involves identifying and addressing care issues, fostering collaboration among practitioners, and ensuring quality and compliance across all aspects of resident care. Together, these updates ensure that medical directors play a pivotal role in maintaining high standards of care and fostering a culture of accountability and excellence in nursing facilities. So let's begin learning. Beginning February 24th, 2025, CMS is implementing significant revisions to the long-term care survey process, which include critical updates to the expanded role of the medical director. These changes emphasize the medical director's pivotal position in shaping the quality of care provided within nursing facilities. The revisions are designed to align with current professional standards of practice and strengthen the accountability of medical directors in their oversight and leadership roles. The expanded responsibilities include the direct implementation of resident care policies, ensuring that physicians and other healthcare practitioners adhere to evidence-based practices in diagnosing and prescribing medications. Medical directors are now required to actively intervene when medical care provided by practitioners is inconsistent with these standards, safeguarding residents from inappropriate treatments and potential harm. By revising the survey process to highlight the expanded role of the medical director, CMS underscores the importance of leadership in achieving high standards of care and protecting the well-being of residents. These changes not only enhance accountability, but also encourage a more proactive and collaborative approach to managing resident care. Facilities must ensure that their medical directors are equipped to fulfill these expanded responsibilities effectively. The recent revisions to CMS regulations emphasize the critical role of the medical director in ensuring high standards of care and compliance across various aspects of nursing home operations. These responsibilities are outlined under several key F tags, each addressing specific areas of focus. F841, Responsibilities of the Medical Director. This tag highlights the importance of the medical director's role in implementing and overseeing resident care policies. The medical director must ensure that practitioners adhere to professional standards, actively participate in facility assessments, and engage in quality assurance activities to promote optimal care for residents. F838, Facility Assessment. Under this tag, the medical director is required to play an active role in assessing the facility's resources and capabilities. The goal is to align care policies with the unique needs of the resident population, ensuring that the facility can adequately meet these demands. F839, Staff Qualifications. This tag ensures that the medical director holds a valid license to practice in the state and possesses the necessary qualifications to oversee medical care. It also underscores the responsibility of the medical director to guide and monitor practitioners, ensuring compliance with care policies and professional standards. F867, Quality Assurance and Performance Improvement, QAPI. The QAPI process relies on collaboration with the medical director to identify and address deficiencies in care delivery. The medical director is instrumental in improving care outcomes and implementing corrective actions, fostering a culture of continuous improvement. F868, Quality Assessment and Assurance, QAA, Committee. This tag mandates the active involvement of the medical director or their designee in QAA meetings. The medical director's input is crucial in addressing care-related concerns and ensuring the effective implementation of policies that support resident well-being. Together, these F tags define a comprehensive framework for the expanded role of the medical director, emphasizing their leadership in ensuring compliance, promoting quality care, and safeguarding the health and safety of residents. These updates highlight the critical need for medical directors to be proactive, engaged, and collaborative in their approach to long-term care management. The recent updates to CMS regulations highlight the medical director's expanded responsibilities across critical areas to ensure compliance, protect resident well-being, and uphold professional standards. These responsibilities are tied to specific F tags, reflecting the pivotal role of the medical director in enhancing the quality of care. F-5-7-6, Drug Regimen Review. This F tag emphasizes the medical director's involvement in monitoring prescribing practices to ensure they align with clinical indications. The medical director is responsible for addressing unnecessary medications and collaborating with practitioners to promote adherence to professional standards. This role safeguards residents from receiving medications that may pose risks without clear medical justification. F757, Unnecessary Drugs. Under this F tag, the medical director must actively intervene when practitioners prescribe medications that are inconsistent with clinical standards or indications. This includes addressing overuse or inappropriate use of medications that could negatively impact resident health. Ensuring accurate and justified prescribing practices is critical in preventing harm. F758, Psychotropic Medications, is now updated in F605 under Chemical Restraints. Although psychotropic medications are now addressed under F605, the medical director's responsibility remains significant. The role includes overseeing the use of these medications, ensuring new psychiatric diagnoses are properly justified, and verifying compliance with protocols for gradual dose reduction. This ensures that psychotropic drugs are used appropriately and only when clinically necessary, safeguarding residents from chemical restraints and undue side effects. F880, Infection Control. This F tag highlights the medical director's role in developing and implementing robust infection prevention policies. By collaborating with interdisciplinary teams, the medical director ensures compliance with infection control protocols, helping to protect residents and staff from preventable illnesses. This role has become increasingly critical in light of ongoing challenges such as COVID-19 and other infectious disease outbreaks. In summary, the expanded responsibilities outlined in these F tags underscore the importance of the medical director's proactive involvement in monitoring, guiding, and enforcing best practices across key areas of care. By fulfilling these duties, the medical director plays a central role in maintaining a safe, compliant, and resident-focused care environment. Understanding the roles and responsibilities within a healthcare facility is critical for ensuring compliance, effective oversight, and high-quality care. Key definitions provide a framework for clarity in implementing care policies and professional standards. Before we review the changes, let's look at the key definitions in medical care oversight. Let's begin with medical director. The medical director is a physician who oversees the medical care and designated services provided within a healthcare organization or facility. This role includes coordinating medical care, ensuring the integration of professional standards into daily operations, and implementing and evaluating resident care policies. The medical director's leadership is vital in fostering a culture of safety, professionalism, and excellence in care delivery. Next, physician or practitioner. This term encompasses healthcare professionals such as physician assistants, nurse practitioners, and clinical nurse specialists who are directly responsible for the medical care of residents. These individuals collaborate with the medical director and interdisciplinary teams to deliver care that meets the specific needs of each resident while adhering to established protocols and standards. The current professional standards of practice refers to professional standards related to evidence-based approaches to care, including procedures, techniques, and treatments that are supported by research or expert consensus. These standards are documented in reputable sources such as manuals, textbooks, or publications, and are endorsed by recognized professional organizations or national accrediting bodies. By adhering to these standards, facilities ensure that residents receive care that reflects the latest advancements and best practices in the field. Lastly, let's review resident care policies. Resident care policies represent the facility's overarching goals, directives, and governing statements that guide the delivery of care and services. These policies are designed to align with current professional standards of practice, ensuring that all aspects of resident care, physical, mental, and psychosocial, are addressed in a consistent and effective manner. The CMS updates to F841 on the role of medical director focuses on the guidance and emphasizes the importance of flexibility, accountability, and active involvement in ensuring effective medical oversight and resident care. While there are no changes in this section, let's begin to review guidance instruction under this section prior to the key changes. Licensure requirement. The medical director must hold a valid license to practice in the state where the facility is located. Refer to F839. If not licensed, the facility must designate a qualified physician to serve as the medical director unless waived by CMS. Implementation and flexibility. The facility must define how the medical director will fulfill their responsibilities through a job description or facility policy. Duties may be performed using various technologies, for example, telehealth, as long as confidentiality and privacy requirements are met. Knowledge and oversight. The medical director must be knowledgeable about current professional standards of practice in long-term care and proficient in coordinating and overseeing other practitioners. Dual role considerations. If the medical director also serves as an attending physician, the facility must establish a process to monitor and address performance concerns to prevent conflicts of interest. Policy development for multi-facility organizations. While medical directors and multi-facility organizations may develop policies, individual facility policies must reflect the unique needs of the specific facility and its residents. Input in policy development. The medical director is not required to sign policies, but must provide input in the development, review, and approval of resident care policies. The medical director holds a pivotal role in ensuring the delivery of high-quality medical and medically related care within a nursing facility. These responsibilities encompass a wide range of activities designed to promote resident well-being, enhance clinical outcomes, and maintain regulatory compliance. Before we review the additional responsibilities, let's review first the comprehensive duties that were already in the guidance. Participation in the Quality Assessment and Assurance Committee. As outlined in F868, the medical director plays a critical role in the QAA committee, either through direct participation or by assigning a designee. This involvement ensures that medical oversight contributes to addressing care-related concerns, implementing effective policies, and driving continuous quality improvement. Ensuring the quality of medical care. The medical director is tasked with overseeing the appropriateness and quality of medical and medically related care provided within the facility. This responsibility involves actively monitoring and guiding care practices to align with professional standards and the unique needs of the resident population. Educational program development. The medical director assists in developing and delivering educational programs for facility staff and other professionals. These programs aim to enhance the skills and knowledge required to provide exceptional care, particularly in specialized areas such as infection control and person-directed care. This role not only supports clinical excellence, but also reinforces the facility's commitment to respecting the rights and dignity of all individuals under its care. These also includes infection prevention and control. In collaboration with the clinical team, the medical director provides surveillance and contributes to developing policies to prevent potential infections among residents. These efforts align with the infection control requirements, ensuring a safe and healthy environment for all. Respecting individual rights. The medical director cooperates with facility staff to establish policies that uphold the rights of residents, staff members, and community members. This includes fostering a culture of respect, dignity, and inclusivity within the facility. Supporting person-directed care. A core responsibility of the medical director is to support and promote person-directed care. This involves facilitating the formation of advanced directives, guiding end-of-life care, and empowering residents to make informed decisions about their medical care options. Monitoring and enhancing practitioner performance. The medical director identifies performance expectations for physicians and other healthcare practitioners, facilitating constructive feedback to improve their practices. They assist in developing systems to monitor practitioner performance, ensuring adherence to regulatory requirements and professional scopes of practice. This includes addressing and resolving issues related to medical care and overseeing tasks delegated to licensed practitioners, such as nurse practitioners. Through these comprehensive responsibilities, the medical director serves as a cornerstone of leadership within the facility, ensuring that care delivery is safe, effective, and resident-centered while maintaining compliance with regulatory standards. The most recent updates, released on November 18, 2024, introduce significant expansions to the medical director's responsibilities in nursing facilities. These changes aim to strengthen the medical director's role in ensuring high-quality, resident-centered care and maintaining compliance with professional and regulatory standards. Implementation of resident care policies. A primary responsibility of the medical director is the implementation and oversight of resident care policies. This includes ensuring that physicians and other practitioners strictly adhere to facility policies on diagnosing and prescribing medications. The medical director must also intervene when healthcare practitioners provide medical care that deviates from current professional standards. This proactive approach ensures that care delivery aligns with evidence-based practices and protects residents from unnecessary or inappropriate treatments. Coordination of medical care. The updates emphasize the medical director's role in addressing issues related to the coordination of medical care. This includes active participation in the facility's Quality Assessment and Assurance (QAA) committee to identify and resolve concerns related to resident care policies and practices. By collaborating with interdisciplinary teams, the medical director ensures seamless coordination and effective policy implementation. Active involvement in facility assessments. The medical director is now required to play an active role in conducting facility assessments. This responsibility involves evaluating the facility's resources, staffing competencies, and the unique needs of its resident population. These assessments ensure that resident care policies align with the physical, mental, and psychosocial well-being of all residents. Administrative leadership and policy development. The updated guidance expands the administrative role of the medical director, emphasizing their involvement in recommending, developing, and approving facility policies related to resident care. These policies encompass all aspects of care, including residents' physical, mental, and psychosocial needs. Additionally, the medical director must address instances of non-compliance with professional standards, such as inappropriate psychiatric diagnoses or the prescribing of psychotropic medications, without proper clinical justification. These updates reinforce the medical director's role as a leader and advocate for quality care within the facility. by emphasizing the implementation of care policies, active involvement in assessments, coordination of medical services, and administrative oversight. These changes ensure that medical directors are well positioned to uphold the highest standards of care. The most recent guidance highlights an example of Level 2 non-compliance, emphasizing the medical director's critical oversight role in addressing diagnostic and treatment practices. This scenario illustrates the importance of proactive involvement in reviewing medical care to ensure it aligns with professional standards and regulatory expectations. The scenario. In this example, the medical director was made aware of residents newly diagnosed with schizophrenia by their physician or other practitioners. However, the medical records for these residents lacked adequate documentation to support the new diagnoses. Despite being informed, the medical director did not review the medical records or discuss the diagnoses with the responsible physician or diagnosing practitioner. As a result, the residents were potentially misdiagnosed and subsequently received antipsychotic medications, treatments that may not have been clinically indicated. While no actual harm occurred in the scenario provided in the previous slide, the residents faced a significant risk of harm by receiving unnecessary or inappropriate treatments, such as antipsychotic medications. These medications carry potential adverse effects and could negatively impact residents if not justified. The lack of proper oversight and intervention by the medical director represents a failure to mitigate this risk and safeguard resident health. Scope of pattern and citation. If this issue occurred with 3 or more residents, it would be cited as a scope of pattern deficiency, for example, E, reflecting a systemic issue within the facility's processes. This reinforces the expectation that the medical director must take an active role in monitoring and addressing medical practices that deviate from standards, particularly when multiple residents are affected. Key takeaway. This example underscores the expanded responsibility of medical directors to ensure that diagnoses and treatments are appropriately documented and clinically justified. It highlights the need for timely intervention, thorough record reviews, and communication with practitioners to correct potential errors and protect residents from inappropriate medical care. The guidance serves as a reminder that even in the absence of immediate harm, the potential for more than minimal harm requires vigilant oversight and corrective action. These takeaways provide a roadmap for effectively integrating the updated guidance into facility operations, ensuring compliance and enhancing the role of the medical director in long-term care. Understand the updated guidance. Familiarize yourself with the expanded responsibilities of medical directors, including oversight of diagnoses, prescribing practices, and adherence to professional standards. Recognize the importance of active involvement in facility assessments, FAFE 838, and quality assessment and assurance, QAA, committees. Integrate responsibilities into QAPI processes. Use QAPI meetings to review the medical director's contributions to addressing care-related concerns, monitoring practitioner performance, and ensuring compliance. Ensure discussions include the implementation of care policies, review of facility assessments, and corrective actions for identified deficiencies. Develop an acknowledgement form to formalize the medical director's review and participation in their expanded roles. Include responsibilities like policy implementation, practitioner performance monitoring, and collaboration with the QAA committee. And focus on documentation and communication. Emphasize the importance of documenting medical director input during QAA and QAPI meetings, including specific actions taken to address care issues. Foster clear communication between the medical director and interdisciplinary teams to align on goals and resolve issues effectively. Support compliance and continuous improvement. Implement strategies to ensure adherence to updated F841 guidance, protecting resident well-being, and maintaining compliance. Regularly assess the effectiveness of the medical director's contributions and adjust processes to meet evolving regulatory expectations. Thank you for watching. We appreciate your participation in Series 2, understanding the updated changes in F841 on role of medical director. Your commitment to staying informed helps improve care standards and resident outcomes in long-term care. Stay tuned! Join us for the next installment of the Regulatory Update series, where we'll continue to explore key changes and their impact on your practice. Resources for implementation. Access sample, informed consent forms, policy updates, and other tools to support compliance and enhance pain management practices are within the link below. Subscribe to our channel for more updates and resources for healthcare providers.